Record your observations on the screening summary form as those with no apparent dental problems, those who need to see a dentist soon for diagnosis and any needed treatment, those who need to see a dentist immediately. Each child's assessed category should be documented in the student's health record. The categories can also be included in the parent letter. The laminated pocket guide is used as a reference while the screening is conducted. It is divided into sections based on treatment need: no obvious dental problems, early dental visit needed, and immediate dental visit needed. At the end of the guide is a section with photographs of other oral findings you may observe. No obvious dental problems. Sound tooth, a healthy tooth with no signs of tooth decay. Stained groove, a groove on the biting surface of a tooth that has been stained over time by food and drink. Stainless steel crown, silver crown used to treat primary molars with large cavities. Amalgam filling, silver metal dental material called amalgam used to fill cavities. Dental sealants, a plastic-like resin placed on the chewing surfaces of back teeth to prevent cavities. They can be clear or opaque. White areas or spots. There are a number of factors that can lead to the development of white spots on teeth: developmental, excessive fluoride intake during development, and nutrition. The type of white spot determines the need for referral to a dentist for diagnosis and follow-up. Developmental, enamel hypoplasia. When new teeth erupt, there may be white spots on the teeth. These spots are formed during development and can appear as milky white. Sometimes the enamel may also be deformed in places. This condition is common. Fluorosis. Very mild to mild fluorosis appears as small opaque paper white areas scattered irregularly over the tooth enamel and is produced by overexposure to systemic fluoride during development. If it is fluorosis, then the white areas will be present when the teeth erupt. Early caries is caused by the leaching of minerals from the tooth enamel, making it weaker. This is considered the beginning stages of tooth decay. These spots usually appear along the gum line of the tooth after teeth have been exposed to decay-causing acids. Children with white spots like these should be referred to a dentist as soon as possible. Tooth-colored fillings, also called composite fillings, and are made from tooth-colored materials that restore the natural appearance of a decayed or previously filled tooth. With the exception of white spots that may be early caries, the observations under this section do not require a referral to a dentist. Early dental visit needed. Small pit and fissure cavities. These types of cavities are small and often difficult to detect. Cavitated, a larger cavity that presents as an obvious hole in the tooth. Temporary filling. Temporary fillings are not meant to last. Usually they fall out, fracture, or wear out within weeks or months. If the filling is not replaced with a permanent material, then the tooth could fracture or have other complications. Students with these observations should be referred to a dentist for care within 2 weeks. If needed, assistance should be provided to help the student's family find the dentist and schedule an appointment. Immediate dental visit needed. Facial swelling is a sign of infection and can be submandibular, located beneath the floor of the mouth of lower jaw, or periorbital, eye area. Perulous, a sore on the gums that is a drainage point for a tooth abscess. Students with these problems should be referred to a dentist within 24 hours for immediate care. If needed, assistance should be provided to help the student's family find a dentist and schedule an appointment. Other oral observations you may encounter during screening. Aphthous ulcer. This is one of the more common lesions of the oral mucosa and is often called a canker sore. It appears as single or multiple ulcers on the mucosa and lasts about 7 to 10 days. These ulcers are usually reoccurring and can be triggered by physical trauma, spicy foods, or emotional factors. If this does not heal in 7 to 10 days, refer to a dentist. Gingivitis is the mildest stage of gum disease caused by bacteria in plaque and is characterized by redness, swelling, and a tendency to bleed. Tooth brushing 2 to 3 times a day along with daily flossing once will help to reverse this condition. A referral to a dentist is not necessary as long as the student has a family dentist. Herpes labialis. The most common type of oral herpes virus consists of recurring crops of small blisters on the lips and is commonly referred to as fever blisters. Recurrences are triggered by exposure to sunlight, fever, and physical trauma. If this doesn't heal in 7 to 10 days, make a referral to a dentist. Oral trauma. A loosened or chipped permanent tooth that occurs during school should be referred to a dentist immediately. Plaque. A biofilm of bacteria and matrix derived from saliva that forms on the tooth surface and becomes visible as it accumulates. This film is removed with regular toothbrushing. Recommend brushing 2 to 3 times a day to the student. In summary, an oral screening is not a diagnosis. Only a dentist can diagnose dental disease. School-based oral screening is optional in Ohio. The decision to do screenings should be influenced by the availability of school and community dental resources for student referral. Conducting oral screening only has value if there is follow-up and resources are available in the community to refer families for needed care. The Ohio Department of Health School-Based Oral Health Screening Guidelines, along with this training video and Oral Health Screening Pocket Guide for school nurses, can be accessed via a link from the Ohio Department of Health School Health and Oral Health web pages to the Maternal and Child Oral Health Resource Center website. Funding was made possible by a grant from the Health Resources and Services Administration, Maternal and Child Health Bureau.